Welcome to another episode of Checking In with the Chamber. I'm so excited to be with Nicole. Nicole is with OndeCare. I'm going to let you just talk all about it. Nicole, what's your role over there at OndeCare?
Well, I'm the founder and CEO. And
that's words for fancy. She's a fancy pants.
No, it's not. It's a word for somebody that's trying to make something different from nothing. But OndeCare is short for on-demand care. So we provide on-demand, in-home care for loved ones of all ages and needs. Our primary source for making reservations is through our website, ondecare.com. But we also have a social worker with more than 20 years experience that also helps our clients pick appropriate care providers or narrowing matches that our system, today's system, can't do as well as the human can.
So I want to pause right there because I want to make this very, very clear that this is a locally owned, for caregivers. There are others out there, and you'd be hard pressed to even get somebody on the phone. And we're talking. This is the care for your children. So I want to emphasize that because I think it's very, very important that, especially, right now when everything is online, I don't want it getting tangled up. This is locally owned. You're right here. Your headquarters are in Chagrin Falls. We were actually joking. I'm in South Russell and it was pouring rain. And and she's like, no, I'm not. I'm in Chagrin. And so you're close. You're right there. So tell us a little bit about what you're doing to help a client. Your client are parents. And what do you do to make their life better?
Right. So our clients are parents or guardians of adults with special needs that can't live alone, or adult children of their parents who they don't want to put into nursing homes, or they have the opportunity to have them move into their own homes or age in place. The difference, OndeCare is like the evolution of the home care agency. We fill the gap for part-time or short-term care. So home care agencies, they're great at what they do, very personable. They can provide 24/7 care for your senior parent that needs that type of care. But OndeCare is that in between provider. If you just need somebody to do errands for them or take them to the doctor because you're busy. You can't be three places at once because you've got kids, a career, and your parents aging. But definitely for children, especially now as we're getting back to work, OndeCare again fulfills that ad hoc nature of what we're all going through. Sometimes you're at home at work. Our schools are coming back with schedules that have us maybe 50% mornings at home and afternoons at school. How are parents are going to handle that? So OndeCare is a solution for our getting back to work situation. We only hire care, safety, and education professionals, so teachers, EMTs.
So let's talk about that. I mean, that is huge. That is huge. So say that again.
We only hire those that are in care, safety, and education. Teachers, teachers' aides, interdisciplinary aides, EMTs, direct support professionals that have years and years experience with those with special needs. Nurses' aides. Nurses actually are on our platform to augment their income. So students that are studying to be teachers or nurses are also on our platform and extremely reliable. And they love what they're doing. So our care providers are that special individual that really has the passion for caring for others. Not everybody can do this. And I'm a business person, and the people I meet that we hire, they impress the heck out of me. I couldn't do what they're doing for OndeCare clients.
Got a heart for it. But let's talk a little bit about your hiring process. I'm assuming that they go through all the standard background checks and those type of things. Yes.
Yep. So it's a pretty convoluted process. We first do a background check, but we do background checks on everybody on our platform, including clients, so that's safe for our care providers. So we do the background check, then they fill out a profile of what type of care they want to provide, and from there we do a 15-minute it's really an introductory interview call. We want to make sure it's a good fit. We talk about the technology nature of how clients find them. We talk about reliability, responsiveness. We only actually interview those with multiple years experience, or students that have, I've been babysitting for 8 years and I'm getting my master's in education. There's multiple years experience plus the passion for childcare. So we do the 15-minute interview, and it's really a two-way street. Is this good for you? This is what we're expecting. And then from there, we'll schedule the full 90-minute interview. And in between there, they do an orientation video. They fill out the complete profile. We help them. And we, again, outline everything that's expected of them. It takes about 90 minutes, and Kim does all of them now today. And we do them either via Zoom like this, or they're coming back. Now that we're back in the office, they come back. We have a large conference room, wear masks, and all the PPE necessary to have safe interviews. And they do a video in our little studio here and record 30-second video talking about themselves that goes on their profile. We're working through the nature of recording like you're doing with me now. But we're not as good as you are, honestly. Oh. The video recordings get a little fuzzy and stuff, and when they transfer from system to system, they degrade. But yeah, from there, then we do back. The final check is reference checks. We get at least 2 reference checks from every one of our care providers, and Kim personally interviews each one of the references, and we use quotes from the references on their profiles. It's kind of like their very first reviews. Excellent. So all of that done before they even are allowed to be on the platform. It's a little different than other technology solutions that are out there. Like I said, we're more the evolution of the home care agency, but for all ages and needs, and we're filling that gap of short-term or ad hoc need.
And how has COVID changed as far as the caregivers and how they're going into the homes, or,
huge,
all the precautions?
Yeah, when COVID hit was one of the things that validated why we've been very serious about care safety and education professionals only. We had to roll out new protocols very quickly that included references to CDC requirements and PPE, and the terms to them, they were already known. They were already educated. It was like nursing 101, as far as they were concerned. They're like, I got this.
And people were depending on you. It's not like you could have just said, you know what, we're going to have to stop and take a break for, 2 months. I mean, people, their livelihoods were depending on you.
Yes. And people, we have clients, they're doctors, and their parents are older, and one doctor in particular, Joey, couldn't go into his parents' house because he was with COVID all day, and his parents are in their 90s, and one has Parkinson's. He didn't want to put them at risk. So OndeCare, we spoke to him regularly. Kim spoke to him regularly on the phone. Our care providers, did the screening every day from day one. Nothing stopped. Our service didn't stop. It can't stop when you have people depending on you like that. But I will say, if I hadn't have chosen that to be a very firm rule here, it would have been harder to flip that switch and require screenings and require, get your masks while we're getting volunteers to sew masks for us. It was a very quick and easy thing, but it's changed us. I didn't have a budget for PPE before, quite honestly.
I bet you do.
Now we do. Now we
You
do.
probably have stock or a stockpile of it as
We have
well.
a stockpile of it. We're delivering it to client sites, especially the elder care clients. It's just so that it's there on hand. So you learn as you go. But yeah.
So you have elderly, you have children, and you have children with special needs.
And even adults with special needs. Some of
Okay.
our clients, especially local here in the Chagrin Falls area, there's wonderful adults that actually have jobs. They're in their late 20s, but they can't drive for whatever reason. And their parents rely on OndeCare to get them to their jobs, to get them to the grocery store, to get supplies, be a companion at times, allow them to live as fruitful of a life as they can live, even if their parent goes out of town. So yeah, the whole spectrum from
Very cool.
infants to seniors.
And by the miracle of Zoom, we are actually going to show people how super easy it is. And I shouldn't say super easy because I don't want to minimize finding the right person for you, but it is easy to find multiple people that could care for whoever you're looking for. So we're going to share our screen here, and Nicole's going to walk us through. If anyone doesn't know yet, I have two adorable twins, which in itself is a specific. It's not easy to find, and they're 16 months. So, you put that on top of it. We'll take them. Can we take them as an example on what we're searching for?
Sure, definitely. So, how old are your twins?
16 months.
16 months. So I would look in newborn and infant if I were you. We recommend that they look, up to 24 months, the newborn and infant, but you could also look in childcare depending on the type of care provider. But I would pick newborn and infant. And from here, you just enter the city, and this, I'm going to do it for it. So you're in Bainbridge, not Georgia.
South Russell.
Okay.
Not that, I'm not that one of those people, but.
There we go. You're in South Russell. And let's say you want to pick a date. Now, right now, we're building OndeCare 2.0, where short-term or part-time, I need somebody on a weekly basis. It'll be a much easier process. It'll work just like this. So instead of picking one day, you can pick a span of dates. But right now, we pick a date. Let's say you want to look for somebody as soon as tomorrow for your twins. Because you have how many of these calls scheduled for tomorrow?
I don't even want to tell you. I don't know how I'm going to do it, but that's good to know that you could find somebody as soon as tomorrow.
Oh, you can find somebody as soon as today. We have one of the coolest things was at 2:30 in the morning, a nurse I don't know why the care provider was up, thank goodness. But she was coming home from a long shift and she wanted somebody to care for her twins, infant twins, actually. And when she got home, so she could rest for 4 hours. And she booked somebody at 2:30 and the care provider responded within the hour. And then she was there at 7:30 in the morning.
Wow.
So right now the system provides you people within a 15-mile radius of your location. So we put Bainbridge, we put South Russell, and we have infant care. We put it for tomorrow. So these 11 people have availability tomorrow and tons of experience to care for infants. So let's take a look at Shonda. She is a firecracker, I have to tell you. She's been with us for more than a year. So here's her little video. But right now, she's got a bachelor's in health science and a certification in gerontology, but right now she works in labor and delivery at university hospitals, and she's the nursery aide in the neonatal unit. So Shonda, her availability around her job is 8 a.m. to 1 p.m. And you could book her for tomorrow starting at 8 o'clock, or Yeah, tomorrow, because it's already 3:20. And say you've got 2 individuals that you want to care for, and however long you wanted, let's say you wanted to take the whole shift. And since it's tomorrow, there is a slight upcharge for that because they're making themselves available.
Sure.
For today or tomorrow. We call it the on-demand surcharge. From there, you just click reserve and say, my twins are energetic. They really need to get up or, early and, require this, whatever job notes that you'd like to have. So I started OndeCare when my son was 6. So my little note is, Henry is sick at 6 and had a fever last night and cannot go to school. Surprise, surprise. That happens to all.
Great.
So you can type in any notes that you want, put your job location in, and if you're first time, you put your credit card in and click reserve. Now, Shonda would have an hour to respond to you and say, yes, I'll take the job. Now, Shonda, she responds within 5 minutes to every gig. There's a spectrum, to be honest, but we're monitoring jobs. So Kim and I know when somebody's been booked. We also know when that time span. So we have a protocol to manage things. If somebody's waited 15 minutes, we're already on it. We're already checking in with other care providers. We have this client that has need for care tomorrow for her twins in South Russell. Are you interested in this job? And then we will respond to you.
You're doing that like on the back end.
We're doing that on the back end. So while Shonda, let's say she's waiting more than 15 minutes to respond to you, we have backup already for you. Now, what's really cool is OndeCare 2.0 will be doing that automatically. And it won't be people. We have a matching system, an algorithm that we devised back in 2016 that we're going to be using for the initial match as well as any backup needs. So that system, but again, we still will have the admin where we'll be monitoring any exception processing. I'm a people and process person. Customer service is my bailiwick. So if we see that somebody's waited extra long or a care provider gets delayed for some reason, we know, and we'll follow up with backup details.
Now let's talk about Shonda.
Mm-hmm.
So she does work at a hospital. How are you making sure that she is safe to go into a house, considering she works in the healthcare field?
Healthcare field in the infant care unit.
Right.
We have 2 major protocols. One is just a regular self-screening. So if anybody finds any one of our care providers becomes in contact with somebody with symptoms or they have symptoms, they have to report and they get paused, if you will, on the system until they've been tested and proven to be safe. If they have a job, they do that on a regular basis. But if they have a job that day of, they do self-reporting. They provide answers to all of the COVID questions that when you walked into the hospital and would answer, and they take their temperature and they record that through our messaging system.
Okay.
And so we get those reports every day from care providers that have jobs. So technically it's all managed.
So let's take a look at, if we could, if we were looking for an elderly care, someone to provide some care for an elderly parent.
Yep. Mm-hmm. So elderly would work the same way. Let's say we're looking from Solon, Ohio.
And do we know these people in the picture?
These people we do not know.
Oh, okay.
OndeCare 2.0 will be people that we know.
Okay.
We're still got stock on our first iteration.
Okay.
Let's say we're looking for day after tomorrow. So here's a nurse, Casey. I know for
there's Shonda again.
And there's Shonda again because she has a gerontology certificate. She does both infant. She does all ages.
And how do you their price point? Do they set their price point, or how does that get determined?
They set their price point.
Okay.
And today we coach them on what's market. Some people put them. So these nurses are very, very well in a good market price. For $21.50 an hour for a nurse is amazing. Shonda's nurses aides is great as well. But there's some people that have put them themselves a little high, but we coach them. So Lanique is a nurse's aide, but she's got 14 years experience and does hospice and end of life coaching. So she's at 25. That's a little high for this market for a nurse's aide. We usually have nurses around 25, but they get to choose their own rate. In OndeCare 2.0, it's going to be a two-way street to help that supply-demand match. So they'll have their rates that they feel it's worthwhile. You can't have somebody coming into your home and caring for your loved ones unless they feel it's worthwhile. Right. So, but we do have, and I think we don't have more. So here's Shanice, she's a doula, and she's at $31.25, which is the going rate for most doulas. So it's there. So anyway, so they have their rate, and then the clients will be it'll be more of a matching and bidding system in OndeCare 2.0, where the client says, I want to pay $20 an hour. The matching system will reach out to the care providers within this price range, and come back with, say, they'll take this job for your budget.
And how, I could say I'm a nurse. What kind of, I would assume that you have to collect their certificates.
We collect them, but all of these, it's all public information.
I'm not a nurse, everybody.
No, I know. But governing bodies for each one of our credentialed care providers, it's public information. The only thing that's not public is like a med student's transcripts. So they do have to provide transcripts. But nurses aides, EMTs, firefighters, teachers, they're governing bodies for each one of these professions, and we can find their certificate to validate that that's theirs. But yes, we ask for them, they apply, they attach them to their profile, and we confirm that that's valid and it's appropriately theirs. But yes, good question. I forgot to tell you, we do a cert verification process.
I knew you did. I just want to make sure everyone else knows it also. So if you, if somebody was coming to you and wanted to say, hey, what's the difference between you and X? What would you say?
Well, it depends on who X is. If we're a home,
I'm talking like the big, the big babysitting places.
Big babysitting online things. Yeah. The biggest thing is all that we do to vet our care providers, and two other things. So what we do to vet them to get them on our platform is one huge thing. Just now, the big technology platforms are now asking for requiring background checks. It used to not be a thing. It is as early as last December, 2019. Well, we've been doing that since 2017. But the other thing is that we do have that personal concierge backup service where Kim, the social worker in our office, and as we grow, we'll have more social workers doing this. And then the third and final thing is right now that we ensure the level of quality. Those big care technology solution providers, their business model is based on subscriptions. So all they care about is that people sign up for their subscription. The actual care episode is not part of their income. So it's not part of their, it's not the highest importance to them.
Right.
We get paid every time a care provider gets booked. So the care episode is important to us. And therefore, we have systems in place to make sure they show up on time. We give them geolocation, tell them, hey, you're 20 minutes away. You better get in the car and go. Make sure you let the client know that you're on your way. Something as simple as that. Mm-hmm. Let the client know how the day's going. Make sure the client knows that you've given John his Percocet or whatever.
So you're giving support, during the time that they're supporting the individual.
Yes. And then there's the backup. Our system right now, it's Kim and I in the office doing the matching and providing backup when necessary. But this 2.0, technically, that matching system will say, oh my gosh, Lanique got a flat tire, but Shonda is around the corner and willing to take this job if you still need us. And so that's there, and it all will be done technically. So that
very
backup,
cool.
There's no backup for any of the tech family care platforms that are out there. This will be the first one.
And now we're just local. I mean,
we're local.
There's just, there's there's no comparison to that special touch of running into you at the grocery store, and I think that keeps businesses on their toes, that they're not going to be giving you bad advice or bad care when I know I might bump into Nicole at Drug Mart.
Right.
Because then I'm going to be going to Nicole and being like, what the heck, Nicole? You set us up with someone that's not cool. And there's an accountability, even though you don't know it, but there is that accountability that Nicole wants to make sure that, she's doing her best. And so she avoids those little Drug Mart encounters. I assume all the staff I'm assuming you have insurance.
We have the same insurance that home care agencies have.
Okay.
So everything that a home care agency has, who sends credentialed individuals into people's homes to care for their loved ones.
And how do you get paid? A portion of their hourly?
It's a portion of their hourly.
Okay.
Exactly.
Okay.
Exactly.
Excellent. Oh, well, I have to tell you, I think that the accessibility, and I'm excited about this new website, because I thought this 1.0 was great, and then I'm assuming those red dots are all where those people live. Like, you would have been able to click on one of those dots. It would have taken you to who that was.
Exactly.
So I was kind of looking at that. Everybody's pretty close in the vicinity. Everybody's around us here.
Yeah, exactly. And that's right now the biggest driver of 1.0 is location. In the future, that's just going to be a piece of the puzzle. It's going to be location. It's going to be preferences. It's going to be experience with autism spectrum, and not just special needs. There's a lot of special needs out there. Experience with Parkinson's, or different things. So the matching system is going to be a little bit more intelligent than what I've got right now.
And you're able to take new clients, I'm assuming. And are you hiring as far as caregivers?
Yeah, we Kim, I think, has 8 interviews scheduled this week alone.
Have you seen a spike because of people that have to offset, maybe an income that's gone now?
We have, and we've actively pursued, we have pursued groups of people, like those with special needs experience, the direct support professionals. Right now, we're focusing on those with teaching, anything to do with childcare, because the new school schedules we need more than what we even have today, available to families that are getting back to work and having half days at schools, etc.
It's going to be an interesting world, but you guys are on it. You guys are going to be able to take care of parents who are fretting right now on what they're going to do. So we thank you for that, and we thank you for your service. This is just, it truly is. It takes away all the work for a person. There's still that work to make sure that you're finding the right fit. Is there an interviewing process between, let's say I want Brooke, am I able to talk to Brooke
Yes.
A little bit beforehand?
I'm glad you brought that up. Yes. Any client that's signed up can contact a care provider. All they have to do is click contact and leave her a message. Are you comfortable with, a 15-year-old on the spectrum? Or, will you take care of an elderly gentleman overnight, or things like that? And it's a two-way street. They can respond. They get an email and a text notification when they've gotten a message. Some clients, most of our clients, are good with what we've done, and they booked the individual after a quick chat or even without a quick chat. But some clients will say, hey, can you come meet my son or my father? And they've done that. They've gone and met without even getting paid. They're professionals.
Right.
They've met for an hour or two, and then they get back on and they book them for the time that they need.
Do you monitor that conversation between your caregivers and the potential?
All for quality's sake, and in case they don't respond or whatever,
Sure.
We're monitoring.
Okay.
So here's Chuck, who's just reported that he is safe for his job of the day, but everything's monitored. for quality assurance.
Very cool. Very cool. Well, this is so great. And especially this time, it's so needed. I mean, between, the schools not being, I'm sure you saw a lot when the schools closed, and now this new schedule that the schools are going to have, and just people working differently right now. They're doing everything they can.
Everything's so different, and the ad hoc nature of our lives as they are today, we're there for them, and that's why Kim is working really hard to get more on board to accommodate this new demand.
Yeah, and FYI, if it is not pouring rain in Chagrin Falls, it will be in the next 2 minutes, because we are in a torrential downpour right now again. Was not supposed to rain at all today, folks. So
I know, it's supposed to be 83 and sunny all day.
I was talking to someone else, and I said, if anything surprises you during this time, I don't know what to say to you, because anything is possible right now, because it just is. Nothing should shock anybody. It really shouldn't. Well, Nicole, thank you so much for sitting down and kind of going through this. I love that we went through the website. I think it showed people how super easy it is to find help today. You are not alone. OndeCare is there for you and there to help you in any way that they can.
Yep, we are.
And obviously we can see it right there. OndeCare.com is your website.
Yep.
Folks, go visit. And even if I want to go out for a Saturday.
Yes.
Saturday night,
you want to check out, go to a restaurant, give them a little business.
Yes, amen. And what about overnight? Any overnight stays?
Overnight for sure, especially elderly care clients. A lot of overnight work, and just today before 2.0, it just requires Kim or I to make a special listing for a nightly thing, but we do that all the time.
Okay.
To get a hold of us, you can just message us here from the site, and both Kim and I get messages as soon as somebody sends a message right from the front of the page.
And folks, what's best about this is it's locally owned. So when we say support local, sometimes you think restaurants and retails, but there are so many small businesses around here that are locally owned that need support all the time as well. So thanks, Nicole, for joining me today. This was great. And we will talk with you soon.
We will. Thanks so much.
Thank you. Have a great one. Bye-bye.
Bye.